This is Congressman Mark Kirk on the week of the historic health care vote. There was a better alternative which could have been considered by the House of Representatives. Working with 33 centrists in the Congress, I drafted the Medical Rights and Reform Act. Our centrist common sense health care reforms came in three basic parts. First, the Medical Rights Act, which would have prevented any Congress from interfering with decisions that you have personally made with your doctor. Second, lawsuit reforms that would have dramatically lowered the cost of defensive medicine. And finally, granting rights to Americans to buy health insurance from any state in the Union, especially if you find a plan that is less expensive or more flexible for your family and your small business. Using these reforms, we would have expanded health coverage. We would have lowered costs for Americans who have health coverage, and we would have covered people with pre-existing conditions. These centrist reforms were rejected in favor of the Senate health care bill, which came before the House of Representatives. I was very concerned about this bill. In basic, the bill spends $1.2 trillion to create a new entitlement program. When you back out the budget gimmicks involving the Social Security Trust Fund, a long-term health care plan, and a college loan savings program, it adds $755 billion to the debts our children must pay. Secondly, the bill depended on a tremendous tax increase, one estimated to cost 600,000 American jobs, over 20,000 in the state of Illinois alone. And the bill also depended on making tremendous cuts to Medicare, a program that 40 million seniors depend on for their very lives. I do not believe that we should create a new entitlement program by underfunding the promises we have been making to Social Security and Medicare. The bill also had tremendous controls by the government on health care, including new mandates on what insurance could be offered that actually increases the cost of health care insurance. This violates a central mission laid out by the President when this debate began last year. On average, we now estimate the cost of an individual health plan in the state of Illinois will rise by $300 a month. I think that's the wrong way to go. When the vote occurred, I voted no because I opposed a bill which tremendously increases the deficit, raises 12 new federal taxes, cuts health care for seniors under Medicare, and makes the average insurance policy for an individual in Illinois more expensive. But we did not prevail, and so we go on from here. If you are concerned about your country in a way you've never been before, I urge you to get involved. We will continue this fight in the Congress because there are other proposals to raise taxes and increase spending or have weakness abroad. I will be working very carefully as a centrist, as a moderate, as someone who supports the free market system to make sure that you pay less in taxes, that we have less spending in Washington, and that you have a greater freedom and authority over your life. Thank you.